Hello, I'm Dr. Elizabeth Hobbs, an emergency medicine consultant. What I am about to say is designed to help you cope with coronavirus infection at home. It's not intended to usurp or replace your own medical advice, and this video is intended for the general population who are otherwise well and who do not suffer from diabetes, heart disease, high blood pressure, immunosuppression and other chronic diseases. I cannot be held responsible for anything that may arise in an individual's case, and if you are unsure of your symptoms, please use NHS 111 online or call 111. Now, when you become ill with coronavirus infection, you may have a fever of 37.8 or above, a continuous dry cough or a sore throat. Some people may suffer headache, a runny nose or diarrhea, and some may lose their sense of taste or smell. When you have a fever, you may suffer aches and pains all over the body, and it's helpful to have a thermometer as it may be difficult to assess a fever looking at or touching someone, especially if you are worried. A fever of 37.8 in adults should be treated with 2 tablets of paracetamol every 4 to 6 hours. The maximum dose of paracetamol is 8 tablets in 24 hours and do not exceed this dose. Take paracetamol regularly until your temperature is 37.2 or below. The good news is that when the fever is decreasing in an adult who has no other health issues, it may mean you are getting better day by day. Keep going with the paracetamol as the fever may last 7 days or so. For children, follow instructions on the paracetamol bottle, and it's helpful for medical staff if you know your child's weight in kilograms. Now, some mistakes patients make taking paracetamol when they have a fever is taking it intermittently and then rushing around because for a time they feel better. Now, this is a definite no for coronavirus because in the early stages of your illness, it is busy multiplying, and it stands to reason that if you stress your body by exerting yourself, for example, having a long run or even just a long day, the virus may get the upper hand. It's sensible to have plenty of sleep, afternoon rests with your feet up to hip height, and sometimes walking about the house. We are human beings designed to move, but don't overdo it. It won't help you in the long run. Respect the fact that there is a battle going on between your immune system and the virus, and you must be a good patient at this time. It's harder than you think, especially with the family around at home. Fluids also help treat fevers, and the best liquid is water. You can tell how well someone is hydrated by looking at the colour of their urine. If it is dark, then you need to drink more. But if there is lots of urine and it's pale coloured, then you've done well. When someone is feverish, they often have a headache, and fluids may help ease this. People with fevers will not want to eat big dinners. They may barely want to eat at all. If you think they need some sugar, then a sweet drink may help. People who don't need to lose weight may benefit from a liquid food, such as Complan or soup. Now, do not underestimate the nuisance of a cough. During the day, it may be irritating, but at night time, it may stop you sleeping, and this is a bad thing as all ill people need more sleep. Prop people up on pillows, take a teaspoon of honey. It's a natural remedy that is very effective, or use a throat lozenge. Some people benefit from throat sprays, whilst others favour liquid glycerol from the chemist. If you suffer from a blocked nose, a nasal decongestant in spray or tablet form is helpful, and it stops you feeling so wretched. If you have phlegm, which is difficult to cough up, then an expectorant medicine from the chemist will help you loosen this. Phlegm is better out than in. Now, coronavirus lasts longer and can hurt more than flu, and even when you are getting better at home, there is a chance that a secondary bacterial infection can cause a chest infection. This may be spotted as green or yellow phlegm, which will require antibiotics, and if people are short of breath, it's time to seek medical advice urgently. Don't wait until tomorrow. If you hear someone coughing at night, get up and help them. Bring them water, puff up their pillows, take their temperature, and give them some paracetamol and other medicines. Don't just roll over and go back to sleep. Take care of each other, treat the fever with paracetamol, encourage fluids and rest well. Be kind to yourself and go gently into the recovery stage. Don't go straight into full activity. Walking in the fresh air, 2 metres apart, is a good thing to do daily, but not challenging runs or cycle rides. Don't sit still continuously. Move as is good for your mental health. If you have recovered, you should have immunity to the coronavirus, and this is what we are expecting for the majority of the population. So if you are struggling to cope at home with a fever of 37.8 or shortness of breath, use the NHS 111 online or call 111. For a medical emergency, dial 999.